Moving on to corneal abrasion. This is disruption of the surface of the cornea that results from trauma. These are prone to infection like any other soft tissue injury, and you can even get tetanus from it. History: patient report ocular pain, sensation of a retained foreign body, often sort of a gritty feeling or like there's a piece of grit stuck in your eye still, blurred vision, and photophobia, very common. Physical exam, you may see red eye, visual acuity deficits. An ophthalmologist needs to do a complete exam, including fluorescein staining, to look for corneal disruption and slit lamp exam. So what you do is you get out a little bit of this fluorescein. I'll show you in a minute. Okay, so how do you treat this? Cycloplegic eye drops to dilate the pupil and relax ciliary muscle spasm if there's any involved, which should significantly relieve pain. Irrigation and removal of any foreign body. After anesthetic, eye drops are administered. That's tetracaine you get, and it's a godsend. It feels fantastic for about 2 hours. Possible antibiotics and nonsteroidals or narcotics on a case-by-case basis. Note the continuous of anesthetic eye drops, in this case this tetracaine, which we use in spinals and things like that all the time in anesthesia. It's never indicated as it impairs corneal healing, promotes ulceration, and may lead even to blindness. Use only once, possibly twice if you absolutely had to, and that's it. I remember reading somewhere about some Hollywood makeup artists giving some actors this makeup, and they were in the makeup room for hours, 10 hours. And I believe they were using tetracaine eye drops, and they kept giving it to them over and over. Big, huge mistake, blunder. You know, I never did find out if it was tetracaine or not, but if it was, you could have ended up in some serious trouble. Here's what a slit lamp exam looks like. And what you'll do is you do some fluorescein. You put a little eye drop of fluorescein, or there's a little strip that you can just wet and touch it near the eye. And then it spreads fluorescein across the area of epithelium that's been disrupted. And it adheres to it. So here you can see where the scratch is. Looks like there's some down here too. Okay. I used to work in a little clinic that had one of these, and I'd work there all alone on the weekends. Then you've got this fantastic slit lamp exam machine that must be worth about $100,000. It was really, I have to admit, it's one of the most fun exams that you could ever do. Here's another one. Obviously, it's a worse type of trauma. This is a pretty bad lesion here. I don't know if this is artifact or if that's an actual piece. This one here obviously is a piece of the cornea taken right out. So it's very easy to tell then if the eye's been damaged or injured, because the fluorescein will stick to that area of epithelium then that's been ruined.